I'm very pleased to introduce Pavani Kottapalli, and she comes to us from the Indiana Wesleyan University. A little bit about her. She's currently pursuing a doctorate in business administration. Good for you. Right? With a specialization in healthcare administration, she aims to bridge clinical expertise with strategic management, and her passions lie in innovation, policy development, and workforce empowerment, which are essential for shaping healthcare's future. Please help me welcome Pavani.
Good morning, everyone. My name is Pavani Kottapalli. I'm doing my doctorate program at Indiana Wesleyan University. Also, I'm a mother of 2 years old right now, and I work as an assistant director of nursing at one of the long-term care facilities. So our corporate is Infinity Healthcare. We have 85 nursing facilities across the United States. So I work long-term care, which majorly serves for the older adults and the psych population. And I was actually scrolling through my phone and looking for the cute picture to post for folks. And then I found one that's my 20s. Okay, I'm 30s right now. So, uh, I just want to give some insights today about comparative analysis of long-term care systems, Netherlands versus in United States. So I have started my career in a long-term care. Actually, I'm a hospital nurse. I was a hospital nurse. I worked in a hospital and neuro ICU, burns, OBR, peds. So like I have vast experience in a hospital systems, right? So I moved to long-term care without a plan. Just it happened because I moved to the different city, and I have to earn something to feed my family. So I went to the long term care and started working at the long term care. And it was a hard transition for me from the hospital to the nursing home. So, mind you, I was working in the neuro ICU with one or two residents, like I'm in a patients, we call clients or patients in the hospital, right? So, when I went to the long term care, we call as a residents. And then 35 patients to pass meds. So I had 35 patients where I have to pass meds in 2 hours. And it was like a great transition. I'm like, am I going to pass these meds? And following the scope and practice, what we were talking about, and then make sure that, all my patients are safe in my hands, right? So it was a great transitioning. And then 3 months of the period, I have a nurse leader coming to me and asked, can you please help me out to be a nurse manager? Like, let me think about it. So I started my career like that in as a nurse manager in the long-term care. Now I'm assistant director of nursing, and initially as a Dr. Okoki, I hope I'm pronouncing it right. Um, s- as she was explaining it to me, and when I went to the long-term care, I was called as hospital nurse. Okay, so there is some kind of failings, like a hidden failings in the nursing home nurses, because when you go outside and say that I'm a nurse from the nursing home, oh, nursing home nurse, why is that? So there is something that has to be changed as an image wise in the nursing home, and also as Dr. Okoki was explaining, and this is a psych facility. When I went there, like anytime they want a IV insertion, call that hospital nurse. Okay, so that's one of the bright side I had. Like, I was enjoying inserting a lot of IVs over there. So it was a amazing journey actually from the hospital to the long term care. And when I was appointed as a nurse manager, and then in a 6 months they were trying to hire the assistant director of nursing, right? And then my therapy director, who is one of my friends, came to me and said, girl, don't take it. So, and then when I said, hey, I already accepted the position and I'll give you 6 months for that position. Like, what's going on here? So, when I started that position, I have seen a lot of gaps that needs to be addressed in the nursing home sector, right? So, I wasn't really trying to just stay in the title. I was trying to understand where the gaps are. So that fueled me to stick with the long-term care. My plan was go back to the hospital. That, you know, as Dr. Robin was telling yesterday, millennials like challenges. So I stuck in the long-term care, and this is going to be my 5th year. So it has fueled me to do a lot of research. I think I published almost 18 research articles, which is related to the long-term care. Uh, Thank you. And may not be everything published in the PubMed, but yeah, highly recognized articles, you can say it. Uh, so I'm also a member of the Global Observatory Long-Term Care Research part because I'm very excited to learn the knowledge from the other countries, like how they are building the policies to address their issues, how they are improving the accessibility, and why do we have a gap. So that is a whole scenario made me to go and research among these two countries, Netherlands and the United States. So both countries are economically highly performing, but we have a distinct approaches for the long-term care. So long-term care in the Netherlands has referred as a golden standard for the long-term care, right? So I wanted to just see um, what are the differences, what are the some things that we can learn from the Netherlands, and how we can advance our long-term care systems in United States. Okay. All right. So I just want to give a little background um, about the aging. Um, so we have globally 1 billion aged population over 60 in 2020 per the reports, and which is going to be double. It's a 2 billion going to be in 2050, which means that out of every 5 people, one of us going to be over 60 on the earth. So that is the global numbers of aged population right now, right? So, and US aging population. So out of our overall population, we have in United States, 22.88% is over 60. And by 2030, 24 million United States population needs the long-term care services. And the demand for the long-term care is increasing because we have a lot of chronic diseases or comorbidities are adding up, right? Our families are stretched thin. Our um, our family members or like our population is actually going to the schools and getting into the jobs and careers, whereas back in the days, right, we have informal caregivers at the home to take care of our elderly. Not anymore. Comparatively, I'm saying yes, so we do have a family members taking care of us. However, it's not happening in every scenario and every family, right? So aim and objective for my study is examine the LTC models to improve equity and access. Objective is compare the Netherlands and US LTC system to inform future reforms. The Netherlands and US are high income countries which distinct long-term care approaches. US leads in healthcare spending but lags in LTC infrastructure. So we spend a lot of money on our healthcare comparative to all the OECD countries, Organization of Economical Cooperation and Development countries. So we have, I think, 38 countries as a members in that OECD. And out of 38, if you see, Netherlands spent 4.1% of its GDP on a long-term care services. That's a commitment that they give for their older adults, right? Um, and also they have a model of a universal long-term care coverage since 1968, and they have a three-part public financing system. So one is like a social long-term care insurance, which means that they provide insurance for long-term care services, and then social health insurance, which is like you can get your OHS and get cared at home. And Social Support Act, which is community-based assistance. Uh, Actually, their municipalities help with their community-based services. That is their model for the long-term care system. And if you see the graph, and you can see where the United States in spending the money on the long-term care, and also you can see the Netherlands is the highest spending country on the long-term care. So I used a little bit AI here. We were trained in our university soon after the AI came, and when they have seen it's not ethically inappropriate, and computer science professor came and he taught us like how to use AI. So this is a little bit of my AI skills over there. Um, so overview of the United States long-term care system. We spend less than 1% of GDP on a LTC or a preventive care. So actually, we spend a lot of money on healthcare overall. Like we have advanced technology, we have advanced procedures in the world. We are the leader in healthcare and sciences and technologies. So we spend overall really a lot comparative to the other countries, but not on the preventive care or the long-term care. That's the difference. Um, so we don't have the no universal LTC coverage. I mean, every country doesn't have same kind of interest or interest about the models, right? So we may not be having the universal coverage, but we do have a different model, which is like our system, financial system is fragmented. We have a mixed payers like Medicaid, Medicare, veterans, and out of pocket we have to pay. I'm sorry. Heavy reliance on informal care. We do rely on informal care. However, when our coworkers want to take a leave, it's not a paid leave, right? So we don't have policies that really helps the families that provides the informal care, or we don't have a system that pays the informal caregivers at the home, right? And also we force our workforce who is part-time, or we force them to at least go on a part-time to take care of the family and also work, or we force them pretty much to get out of the work environment and take care of the family, which is sad, right? So this is a comparative summary table. I just enlisted like a funding model. So when it comes to the Netherlands, it's a public universal, and United States, it's a mixed. Eligibility criteria. Our criteria is income based. So you will be eligible to the Medicare, I mean, a Medicaid if you are with a low income. And eligibility criteria for Netherlands, it's a needs based. So if someone has high equity of a healthcare needs, then their eligibility for the healthcare, I mean, a long-term care services is high. And long-term care access are high and equitable in Netherlands and limited and inequitable in United States. A cost burden paid income adjusted, and we have a high individual burden. So we spend, if we have to take care of our elderly at home, we spend a lot if we do not have a Medicare or Medicaid benefits, right, out of pocket. And informal care, it is a moderate in Netherlands, and United States, it's a high. And long-term care quality is a high in Netherlands, and it is variable or often low in the United States, because we have a situation like, majority of the Medicaid intake buildings are poorly funded. Staffing levels are low. Infection control is kind of a low quality, we can see over there. And we also have a lot of safety issues too in the Medicaid buildings. So we need a transparency, or a complex um, quality oversight from the public health at the Medicaid buildings, which has to be improved too. So this is a SWOT analysis of the United States. So just to take a quick look, what are the strengths and what are the opportunities or weakness and funding instability. So I'll start with the strengths, and it is the diverse care models, and we do have great tech integration, and we have a great regulatory framework. We have a great framework. And opportunities, aging population needs, um, we have seen global perspective, and even in the United States, we have compared the numbers of how the aging is going up, right? So we have a demand and expand home-based care. So we do have a home-based care, and I think we have to expand it, because we want to, end of the day, we want to treat or serve our older adults with the dignity and respect. If they want to age and retire at the home, let them do it, right? So we have opportunity to expand home-based care and geriatric training, tech innovation. So we can still collaborate with the technology. Although we have advanced technology, we don't integrate everything into everything because it costs a lot of money. So weakness is a high cost and workforce shortages. I think workforce shortages actually in the Netherlands too, in any country you take it, but I'm comparing like how severe it is, right? And it is a fragmented care, quality disparities, we have as a weakness. And then when it comes to the threats, funding instability, and regulatory burden, and pandemic risk we have seen. So we have all these problems ongoing already, but a pandemic just made us to look closely what are the issues in the system, right? And also the legal exposure. I think States nurses are more liable than any other nurse in any other country. We have a lot of legal, like a liability, right? So that's that was the United States. So now I want to uh, give some insights about our SWOT analysis about Netherlands. So as we were discussing, the strengths are universal long-term care coverage, which means that everybody who requires the healthcare, they can get the healthcare in the Netherlands. An integrated care model. So the way they set up the financial model, it's very integrated. You have a long-term care, home-based, and then you have a vouchers, and then you have a community-based. So it's very straightforward, very simple model, right? And strong primary care based, and they spend a lot on the primary care too. So if we don't want anybody to come to the hospital that don't need to be there, we have to do it. That's how we cut the cost, right? Um, and the digital healthcare, I'm sorry, I'm reading the opportunities, digital health advancements. So they do rely on the technology, and they do rely on the telehealth and aging in place policies. Their policies, still they can improve the policies and prevention focused models. So they still can work on prevention focused models. And when it comes to the weakness, rising cost to sustain model. So Netherlands is spending a lot of money, but how it is going to sustain for long term. So they have to do some proactive um, policy developments, or like do the homework before we get to that point, right? Netherlands has to do that. And staff dependency on the migration. Actually, their staff majorly from the migration, like, from the different countries. So I think they can work on creating their own workforce in the country, right? And then bureaucratic delays. I think this every country has some kind of weakness like that, right? And the threats, a financial strain on public insurance, and workforce shortages and long wait times for services. So we have a long waits too. When we go to our ER, how much time it take for us to get to the service, right? Uh, so what are the policy recommendations actually we can come up from this study? So, as I was explaining, in the United States, especially when we are uh, um, we are looking at the low-funded nursing facilities, right? We have a poor quality, and also which can be lead to the financial exploitation in the Medicaid buildings. Because if you guys ever thought about it, the hospitalization rates in the Medicaid buildings are very high, correct? So why would that happen? I get it. Sometimes it's a concern of the quality, and the another issue is financial exploitation, which means that to activate the Medicare benefits, some transfers take place where you cannot get the like a post-skilled care, you will get paid more, right? So to make that kind of a Medicare revenue, the hospitalizations rates also goes up. And about the informal caregivers, as I was talking, our informal caregivers in the United States are majorly women, correct? Majorly women. Mostly women provide the majority of the care without a pay or a job protection. So we have to work on a job security for our population that provides the informal caregiver. And facilities that accept the Medicaid often struggle with the underfunding, leading to low staffing, as I was explaining, and poor infection control and high hospitalization rates. And in these facilities, actually, the population that is occupied economically low or minority groups. So in the Netherlands, vice versa, actually, like they get the LTC vouchers, so which means that they give that kind of authority for the resident. It is your choice whether you can get cared, if you want to get cared at the home or you want to get cared at the long-term care. So you can be at a home and you pay the informal caregiver or the home health nurse and be at home and with the dignity, right? So um, there also their LTC population is majorly also low income group. However, it is because of their family systems, not because that they are not forced to go to the poor funding. Also, the difference is that they do not have the low quality in their nursing homes, right? That's the difference. Um, so the patchwork system inflates the administrative cost and create inefficiencies. It also opens the door to financial exploitation, as I was explaining. So, what can we do better in the United States? And what are some lessons that we learned from the Netherlands LTC system? So, if we all can think, we need some kind of quality framework in the long term care system, especially when it comes to the Medicaid funding facilities. And also, we need to work on our policy for the workforce that is being a part time or the full time informal care, trying to stretch their energy between making the revenue and taking care of the family. So we have to build some kind of policy, or we need to put some kind of work over there for to develop the policy, right? And also establishing the centralized LTC financing systems. Ours is a fragmented financing system where we can convert it to the centralized long-term care financing system where we can monitor the system very clearly and see where the funds are going and come up with the I would say useful spending. And then we have to develop a needs-based eligibility model, just like Netherlands. We need to come up with a needs-based system. And Netherlands also has the opportunity if somebody apply for the long-term care system and then they get denied, when their needs change and when they become a complex medically, they still can go and reapply. So your application is thoroughly monitored. So if you applied in 2022 and you're coming back in 2025, they have one system where they can go and look for your application, right? So we need that kind of an integrated system in our country too, and launch public and private pilot programs that offers a flexible, affordable long-term care system for the United States. And fund caregiver support programs, including tax breaks and paid leave and respite services, improving transparency and oversight in the long-term care facilities, and encourage bipartisan collaboration to pass along long overdue long-term care reforms combining financial sustainability with social equity. So we do not have to replicate the Dutch long-term care model exactly. We have bright minds. We are the leading country when it comes to the science and the healthcare. We have advanced technologies. All we have to do is that we have to come together and think about the issue and integrate the systems and develop the policies that helps this population. We all going to age one day, right? It's not, oh, I'm 20 now. I don't have to do anything with it. Yes, we do. Um, So these are some of the policy recommendations. Um, Centralized national LTC financing, needs-based eligibility criteria, public-private partnerships, workforce support, and the U.S. must move toward integrated, equitable LTC systems. Learning from the Netherlands can help reduce health disparities. Importance of policy reform, financial models, and family support. So I just want to give a quick picture how the market size is for the long-term care. You can read those numbers, how big those numbers are. That's our market size going to be. We are growing at like a 6.7% and 24 million users going to be by 2050. We have a 24 million users. So that is the opportunity we have. And if um, experts from the healthcare who can effectively integrate the models and come up, and that's our market size. So that's the summary. You can read, and as I was explaining, those lessons we have to learn from Netherlands is pretty much the integrated system and strong community support. Those are the references for you all. And this is not just a policy discussion. It is about the moral imperative. It's a call for the action to rethink and revisit our systems, how we are going to treat or serve our elderly with the dignity, equity, and sustainability. So please think about it. And if you have a questions, please let me know. And I would appreciate your questions because that would provoke me, maybe if I have to do some more research and get better. So please let me know if you have any questions.
So is there anything that you or your organization is doing to help advocate for those policy changes currently, or do you have any plans for that?
Yes. So that is one of the reason I'm stuck for 5 years in the facility. Also in the long-term care. I do have a lot of passion right now for my long-term care systems. I'm definitely working towards it, and probably I have to network with more people that has expertise to bring some value for the policy development. Yes.
Um, this is a difficult time to be advocating for any advancement in caring about the elderly or science or um, any of that. So what is your plan, I guess, to tackle this from a policy standpoint? Because quite frankly, I don't see it making any progress at this time. And I hate to say that, but we're we're in a time of slashing everything. So I don't think they're going to uh, listen, no matter how you present the data and no matter what the data says. So do you have a plan for how you would tackle that?
So I would say anything to do with the policy development, it's not going to happen immediately, right? I think if this is the time to do your groundwork, yes, this is the time to do your groundwork and be ready. Whenever the time comes, it's going to come into the light. However, um, there are a lot of people with a compassion working on it. I can see it, and that is one of my motivation. I would say, like as I was telling, when I initially started in the long term care, how demotivating those talks were, those like demoralizing conversations. But I have learned and grown from that. And as I was telling, I'm a member of the global observatory systems that where I can see what Switzerland is doing, what Netherlands is doing, what other countries are doing. So I think that fuels the motivation still, with the hope that we are going to do better. So yeah. Yes.
Have to stand up for this one because, okay, we have to bump this beyond policy. You are
Yes.
totally on point. Um, for those of you who think the following word is a bad word, I hope not. That's a woke agenda. We believe that people in this country deserve better no matter what age we are, and we are under duress. We have to do more than just talk about policy. We have to find a way to change the politic that's creating the policy that's undermining the health of all Americans in this country. So I'm bumping it up. This is a political issue. This is not just a policy issue. And we cannot be afraid to lay in front of the bus. This is a time when standing up um, can have serious consequences. And if you just read the headlines, the judges who are not supporting the current policies have just been arrested for speaking up and preventing the policies from going forward. So we are in a dangerous time, and I think I would hope that we can take from here not only the knowledge, but the will to make a significant statement about what the future has to be for those of us who live in the United States. Thank you. Thank you very much. It was
Thank
very
you.
helpful.
Thank you so much for your topic. And I just want to let everybody know here that I continue to be an advocate for my students, and I want them to be an advocate for themselves, their patients, their community. And I tell them, you have to have a voice and you have to use it. and you are no better than any politician or anything like that. And we just have to be active and encourage them. And I have had a student that has made a difference in, mental health issues. And there have been some changes in how police respond to mental health crisis and things like that. So people can make a difference. I just don't think people should just give up. Again, if you lay down, better be in front of that bus.
Any other questions or comments? Yes, ma'am.
I just wanted to add that what you said about laying the groundwork right now, I think that that is super important. For me personally, it's really easy to get very disheartened by all of this, but I think you're doing an amazing job laying that groundwork and continuing to chip away at the block of this issue. So I just wanted to say thank you for doing that, because I know it can probably be incredibly disheartening, especially as you start to look into policy and start to try to advocate for it, start to try to get into the political arena, which is ultimately where it has to end up. So keep doing what you're doing and don't let them get you down.
Thank you so much. Actually, conferences and being a member in certain groups with people of expertise will help a lot. Because let's say that you are in your own workplace and a lot of demoralization or people with demotivation is dragging you down, just find your ways. Yeah, so it's
Any other comments or questions? All right.